Back pain in pregnancy is common and it happens as your baby grows, your belly bump increases inside, and it also happens as a result of a particular hormone called relacin that loses the joints. Okay, when this happens, you begin to feel back pain. There are times this back pain can be abnormal. When it is normal, it's a back pain that is mild to moderate. That is, the pain is usually mild to moderate pain. Okay, the kind of back pain that happens when you have stood for too long or you have walked for too long, and the moment you relax, that is, you rest or you do some kind of stretching or you massage, it gets better. That is, it gets resolved. Okay, if you're having this kind of back pain, it is normal, it is common in pregnancy. But when it is abnormal, which requires you to seek immediate medical attention, is the kind of back pain that is severe or happens suddenly. Now, after resting, stretching, and changing position, it does not get better. It rather becomes worse. This back pain can also be associated with vaginal bleeding or fluid leakage. That is, you're leaking amniotic fluid. It can also be associated with fever or chills, or you are experiencing burning sensation while urinating. Okay, the kind of back pain that you're having and you've noticed that your baby's movement has reduced or you can't even feel it any longer. These are not normal back pain. It means you should seek urgent medical care. All right. Pain or burning sensation during pregnancy is not considered normal. It is not something you should ignore because it's likely you are having what we call urinary tract infection. Urinary tract infection is very common in pregnancy. Reasons because as your womb grows, your uterus grows, it puts pressure on your bladder, making it difficult for your bladder to be emptied completely, and this enhances the growth of bacteria, leading to urinary tract infection. Another cause could be as a result of progesterone hormone that relaxes the muscles of the urinary tract, making urine to flow slowly, and this also breeds bacteria that can also lead to UTI. It could also be as a result of reduced bladder tone, and naturally we women, we have short urethra, and bacteria from our skin or even from our bowel, so that is the anus, can easily move to that area, increasing our risk of having urinary tract infection. If you have this symptom, it is not by boiling hot water and be dipping your vagina inside that will resolve it. That won't resolve it. It is not by you going to the chemist or to the pharmacy to purchase drug and start taking on your own. It is risky. Remember, you are pregnant. The right thing to do is to let your healthcare provider know. That person managing your pregnancy, let the person know. They know the right way to manage it for you, to relieve you of that discomfort. Now, if this UTI is left untreated, listen, it can actually cause kidney issue for you, and it can also make you to have premature labor, and I'm sure you wouldn't want that for yourself. Despite the fact that UTI is very common in pregnancy, it can actually be preventable by doing all of these things I'm going to list now. Number one, drink plenty of water during the day, except you have been advised by your healthcare provider to reduce the amount of fluid you take. Number two, don't hold your urine. Always urinate whenever you have the urge. Okay. Number three, each time you go to urinate, ensure you empty your bladder completely. Try as much as you can to do that. Number four, wear breathable undies like cotton undies. They actually allow air into that area. After urinating, while you're trying to wipe, please don't wipe from your anus to your vagina. Wipe from your vagina, that is from the front part to the back side. Okay? Try to urinate before and after sexual intercourse. The moment you finish having sex with your partner, the next thing is not to cut. Please go to the restroom and wash off immediately and urinate as well. Number 6, if you're the type that usually use scented feminine product like scented pad, scented tissue, scented wipes, please stop using scented feminine products. Use non-scented ones, okay? And stop douching. Stop doing that. If you're able to keep to this rule, you will see that the risk of you having UTI during pregnancy will be reduced. All right? Bye.